Transsexualism, gender identity disorder, gender dysphoria. These are three iterations of a mental disorder seemingly about trans people, as classified by the DSM. We'll look at each in detail, but first, what exactly is a mental disorder? And what is this DSM? In the practice of psychology, there's a well-known book called the DSM, short for Diagnostic and Statistical Manual of Mental Disorders. It catalogs all existing mental health disorders in detail, along with their diagnosis, criteria, and treatment options. It is looked at as a sort of Bible in clinical psychology, used by psychologists, psychiatrists, and practitioners alike, and it regularly gets updated, or as the DSM puts it, revised. So far, the DSM has gone through 5 revisions over 7 editions. For a condition to end up in the DSM as a mental disorder, it needs to have one or more of the following criteria: causing dysfunction, causing emotional distress, as in emotional pain or suffering, causing emotional deregulation, and lastly, deviancy. To put these 4 points in perspective, OCD or obsessive compulsive disorder can often lead to literal dysfunction in one's day-to-day life, while PTSD or anxiety disorders tend to cause high levels of emotional distress. And bipolar disorder triggers emotional deregulation, from manic to depressive, for example. When it comes to deviancy, however, the DSM tends to get pretty wishy-washy, since deviancy is defined as that which deviates or differs from an expected status quo. Thus, historically, the practice of psychology has periodically labeled some perfectly normal things as abnormal, based on social discriminatory beliefs about those things held at that given time. A sad example of this is how homosexuality was classified as a mental disorder, often forcing barbaric treatment plans such as conversion therapy and or electroshock therapy to cure the gay away. Thankfully, the practice of diagnosing same-sex attraction as a disorder officially ended in 1974, though the stigma of it being thought of as one lingered long thereafter, and even in some places to this day, which brings us to transsexualism. Transsexualism as a mental disorder formally entered DSM-3 in 1980. While on paper it sounds like it's about trans people, in actuality it was the residuals of homosexuality still viewed as a disorder in disguise. That's right. Transsexualism had far less to do with gender identity than it did about the treatment of what psychologists at the time thought of as a disorder that could only affect the gay. Sexual orientation was a central criteria in the diagnosis of transsexualism. Transsexuals were essentially viewed as male homosexuals who've turned so effeminate that they'd start identifying as heterosexual women, and vice versa for trans men. During this era, terms such as homosexual transsexuals were often in use, and research usually focused on homosexual factors in an effort to understand transsexuality, deeply confusing sexual orientation with gender identity. So, what about trans women back then who weren't exclusively attracted to men? As we know today, only a third of trans people are exclusively into men. According to transsexualism, they would not be deemed to be true transsexuals, and instead be diagnosed as suffering from a sexual perversion called transvestic fetishism. Leading psychologists at the time were so hell-bent on this idea that they'd even declare bisexuality for trans people as an impossibility. You had to be homosexual first, as the underlying idea behind treating transsexualism was to help a trans patient cross over into a model of heterosexual normality through transitioning them and their bodies, which is why trans patients of any other sexual orientation were rejected, and desiring bottom surgery was even made mandatory. Since the majority of trans people seeking medical transition at the time did not fit these arbitrary criteria, many were turned away, told they were not trans, and even worse, gaslit for having a sort of perversion. As you can imagine, psychology very quickly made an antagonist out of itself in the transgender community. This is how and when the term transgender rose to popularity. It was coined around this time as an alternative term for trans people, in contrast to transsexualism, which at the time was a rigid concept made up and policed by psychologists. Fortunately, with some social progress and better understanding of trans people, many of these outdated views and practices were thrown out and replaced with a far less authoritative and more comprehensive iteration in 1994. Gender identity disorder, or GID for short, replaced transsexualism with the release of DSM-4. GID came with a complete overhaul of the core concepts and perspectives in psychology regarding the trans population. Firstmost was the removal of sexual orientation as a central criteria. No longer was having a specific sexual orientation necessary for being trans. Gender identity was finally recognized as separate from sexual orientation. Additionally, standardized transition procedures, such as having bottom surgery, became less prescribed and more dependent on whether the trans patient desired to have them or not. Another major change was in the gatekeeping of trans identities. It was no longer up to a psychologist to approve or disapprove someone being trans, but rather only to help them figure it out for themselves and assess along the way if one was ready for certain medical transition options, such as starting HRT. Gender identity disorder also saw a huge shift in terms being used in the medical profession, which were more representative and respective of transgender identities. A trans female, for example, now meant a trans woman, and a gay trans woman meant a lesbian trans woman. Almost a 360 from how terms were used during the transsexualism era. Mind you, not all of this happened overnight. Some institutions were quicker to adopt, while others were slower to catch up. Nonetheless, under GID, gender-affirming care saw a more sensible approach towards its trans patients, and research about trans people became more practical, more ground up. All in all, the era of GID made gender-affirming care for trans people more accessible and less judgmental. With all its merits, however, gender identity disorder still regarded being transgender as nonetheless akin to having a lifelong disorder. It wasn't the name after all. Gender identity disorder. By 2013, as being transgender became less stigmatized, more and more trans people were experiencing happy, fulfilling lives without anything disorder-like, especially after transitioning, which made it clear that being trans in itself wasn't a disorder. Then what was? In 2013, gender identity disorder was replaced with gender dysphoria via DSM-5. Instead of pathologizing the trans identity, gender dysphoria saw a shift towards focusing on the emotional distress caused by the gender incongruence which trans people could experience before transitioning. So, to answer the question posed by the title of this video, no. Being transgender is not considered a disorder in the practice of psychology and has not been so for as long as 12 years as of the making of this video. If a trans person does not or no longer experiences gender dysphoria, then there is no disorder to treat. This was further emphasized in the 2022 revision that not all transgender people experience gender dysphoria. The current DSM also went through an update that made it more inclusive, especially regarding non-binary and gender non-conforming individuals. In practice, this also made medical treatment options to be more flexible and considerate of the specifics of one's dysphoria, which can look very different from trans person to trans person. All in all, gender dysphoria in the DSM-5 represents an evolving comprehension of gender diversity and provides a framework for understanding the psychological experience of transgender and gender diverse individuals without viewing our identities as disordered. Unfortunately, the stigma of being trans seen as a disorder still can linger for some people and in some places, illustrating just how easy it can be to mistake diversity or being different for deviancy. Thank you for watching. If you'd like to see more, like and subscribe. I am Lilith Lahlur, and these have been some of my musings.